We also know that depression is an inflammatory disorder, which is very interesting. Major depression is associated, this is a recent paper published this year, the journal Psychiatric Research, and it says major depression is associated with a high omega-6 to omega-3 ratio and an elevation in the cytokine IL-6, which is a pro-inflammatory cytokine. And both parameters were found to be significantly correlated, as you can see with these graphs here. And so depression is characterized by a peripheral pro-inflammatory phenotype that is clearly associated with an elevated omega-6 to omega-3 ratio. And interestingly, the inflammatory state persists even when patients become normothymic or are effectively treated with an SSRI. And so the lesson learned here is that you can treat patients with antidepressants, they can feel well, but if you don't correct the underlying inflammatory state, then it's a very high likelihood they're going to relapse into depression or maybe never be able to get off those SSRIs. Certainly what we see in primary care today is a very remarkable increase in the number of people who can't get off their antidepressant medications. I'm amazed compared to when I first got out of practice 25 years ago, how you used to be able to treat someone with an antidepressant for a few months, you'd stop, they'd be cured, basically, most of the time. It's, I would say, not unheard of anymore, but it's much less common. It may be because we're not treating people holistically, thinking about things like omega-3 fatty acid deficiency, magnesium deficiency, these very rudimentary things that play a central role in cellular function.